lights on. What has happened? This is an older person. Oh, the likelihood is it's a primary heart problem, an electrical problem like the switch. The heart is probably fibrillating in the chest. I'm going to do continuous chest compression CPR. If you're trained at a higher level, hey, hoorah, I'm really happy. Do your certification. If you can't remember anything else, if you want to spread it to your family, do continuous chest compression CPR. You got a 3-year-old, you're going to say, oh, this is a child. He's probably having lung problems first. I'm going to do my traditional CPR and breathe and do compressions. Yes?
Is it true that like a young child, like 3 to 6 years, can be revived after like an hour after drowning?
There are stories of revival after lengthy periods of time. There are some factors that increase the chance of survival. Cold being one. If a person is cold, they even put people in a state of hypothermia, cold, to slow their body metabolism down to help give them a better chance of survival. Small children, as opposed to somebody who is maybe 80 or 90, you have a younger person generally has a better chance just because their overall body is healthier. If you have a body that's weakened, the chances of survival are less just because their whole body system is weakened. Yes?
Isn't another reason why you use less pressure on infants because the bone structure is not strong yet, it's flexible?
Absolutely, absolutely.
In my lifeguard training, we are told to ask the person if they're still conscious, if they need our help.
This is a really good point. We were talking about this earlier. If you have somebody who's got a high-pitched sound, sounds like maybe that they might be choking, but they're not necessarily blue, they're not necessarily on the ground, they're still moving some air, we don't mess with them. Because we can cause that thing to lodge even deeper or further and completely cut off their airflow. In our situation, this is somebody who collapses, is not conscious. We're rubbing on them, we're shaking on them, they're not responding. They're not breathing or they're not breathing normally, then we compress the chest continuously. Yes, this gentleman here.
If you're doing CPR and so on for like 5 or 6 minutes, wouldn't that keep the chance of survival up?
Yes, that's the whole point. You're keeping the chances of the brain coming out of this, the kidneys coming out of this, the other vitals coming out of it, just by circulating that blood. Yes, sir.
I know this is kind of off subject, but in certain cases, a person can get a legal slip saying that they do not want medical treatment.
I actually happen to have one of those people. Hang on 1 second. Down into the either of the hand. Oh, I say that, and maybe not. Oh, actually, I don't have anything. In Arizona, if you do not want resuscitation, you have to have an orange piece of paper, not a white piece of paper, not a blue piece of paper, not a red piece of paper. It's an orange piece of paper that says, do not resuscitate. We have these little nifty little armband that says on one side, do not resuscitate, and on the other side, allow natural death. Natural death means, hey, listen, I'm all good with things, my heart stops beating, don't resuscitate me, I'm good to go. Somebody who's got a sickness, they've got cancer, they've got other problems. We all know that they're going to die sooner or later. They go to their doctor with their orange form, the doctor signs the form, the patient signs the form. If their heart were ever to stop beating and they were to experience sudden cardiac arrest, and that form is right with them, the paramedics would come in and say, oh, he has a orange do not resuscitate form. He has his armband on, we're going to look for his do not resuscitate form. And then they would call the doctor and say, hey, listen, he has a do not resuscitate form. And the doctor would say, don't resuscitate. And that's how that goes.
Would you have to be more gentle with elderly people, like just like with babies, or no?
I'll tell you, I've done a lot of CPR on elderly people. I've worked in retirement communities most of the career. And elderly people are so frail, their bodies are so frail, sometimes